The human toll of BC's overdose crisis is heavy. More than 12,700 lives lost since 2016.
And I miss my son. I want people to remember that he's not a number, that nobody is a number. He had a wonderful, big smile. He was warm and kind.
Shirley Wilson says she lost her 24-year-old son, Jacob, to an accidental fentanyl overdose 2 years ago.
Jacob never wanted to be an addict. Jacob wanted to be released from pain.
Jacob was run over by a pickup truck in 2018 and ended up with a cracked skull and brain bleeds. Wilson says he did have drugs in his system that night.
He had fentanyl, he had cocaine, he had cannabis, and he had alcohol, a high alcohol level.
But she says the injuries led him to more drug use and psychosis. She says her son desperately wanted to overcome addiction, but struggled to get the support he needed, from mental health counseling to hospital care. She says he was discharged twice from the Abbotsford Hospital 48 hours before he died by an overdose. Fraser Health says it can't comment on individual cases. The health authority points out that under BC's Mental Health Act, staff can't force a patient into treatment and must respect their right to freedom. The BC coroner says an investigation of the death is still underway.
It was 3.25 years of unbelievable trauma for me and my family. Alone. Much of it was alone.
Wilson, who is also a school trustee in Abbotsford, is committed to stopping the stigma.
It can happen to anyone. It happened to us. It can happen to anyone. It doesn't matter about the parental upbringing.
This year, the highest number of deaths happened in urban centres like Vancouver, Surrey, and Greater Victoria. But from big cities to small, the crisis has no boundaries. So, Polly, what is the human toll of this crisis in Cranbrook?
Now at supper time, people are talking about who else is lost. And I don't think there's any household in Cranbrook that doesn't know about what's going on, or someone that has lost somebody.
The drugs are becoming more toxic, leading to more overdoses. She says about 50 people have died since 2016 in Cranbrook, and more support is needed.
People are exhausted. I can't say enough that the province needs to include people with lived and living experience at the policy changing tables around safe supply, drug checking.
The province says it's working on vital solutions to help save lives, from expanding treatment with more substance use beds to increasing access to more medication-assisted treatments and adding more community counselling services across BC. Changes that for some are coming too late. Over the last 4 months, CBC News has spoken with the families of 35 people who have lost their lives to overdose, families sharing who their loved ones were and what they were loved for in these obituaries at cbcnews.ca/BC. Each fading light is a reflection of the many lives this crisis has taken. Baneet, Braich, CBC News, Vancouver.